Hey, fellow YouTubers, YouTube Nation. I want to talk to you a little bit today about healthcare in North America and Europe and that. Well, the truth about healthcare, it's not what you think it is. It's the statistics show that in the states alone, doctors actually kill 540,000 people every year. Now, if you want to know what that adds up to, in Vietnam, 45,000 troops fell. Also, you take like World War II, the Americans lost about 289,000 people. Canadians lost 39,000 people in that war. But just in the States alone, as again I say that doctors have killed 550,000 people, and that's every year that statistic maintains itself. And it's from neglect or wrong diagnosis or improper drugs, whatever the effects are, wrong treatments. And healthcare is an industry. It's not this noble trade. Doctors are quick to market. They don't most of the time they don't even know the patient, and they can't diagnose. I mean, how many people you've heard say, well, I went and I had a problem, and it took me 15 years to find a doctor. I had to go through 15 doctors till somebody finally found out what was wrong with me, and that improved my health. I mean, this is typical of people's circumstances, and I've listened to a lot of tragic stories. I'll tell you something. I know a woman. She's 93 years old. She lives in I guess you call it a trailer park, whatever. It's a nice little trailer that she has, and she lives with her son. Her son was taking care of her. He's about 60 years old, and he was taking care of her. And they were happy living there. She was 93, and she was just happy not to be in a senior's home because she doesn't want to go. She wants to stay in her home. It's quite a nice place. I know where it is. And one day the doctor said, "Oh well, you've got the arteries in your heart are clogged up or something, and you'll need bypass surgery." So he agreed. He said, "Okay, well, I guess you guys know what you're talking about." And if you know anything about bypass surgery, they take the veins out of your legs and use them to bypass the arteries in the heart, so that the blood flow is better. And so he underwent this surgery, and then shortly after, I don't know how long it was, a month or so, it was discovered that because the veins were removed out of the legs circulation was so bad that they had to amputate both his legs. And now here's this guy living in a trailer home in a wheelchair, and this poor woman who's 93, going to be 94, she's just a frail little thing, is now having to take care of him to keep him out of a nursing home. And this is just, I listened to story after story after story of people and their suffering and the suffering of loved ones. I was 5 months in a hospital for infection and certain health problems, and so I had this opportunity. I just sat there and listened to people telling me the stories that health stories. I mean, you get a bunch of people together in a hospital. What do they talk about? They talk about their suffering, the suffering of others. I mean, it seems to be the theme there. So healthcare is not. I've dealt with many doctors, and half of them don't even know what they're talking about. You should see them deciphering test results. I mean, they use this word suggest. Well, the test suggests this test suggests that. They're really into quick fix. It's a mill. Hospitals are a mill right now. Doctors are offices are a mill. I go to my doctor for over 30 years. This is over 30 years, every week to every 2 weeks for 30 years, and this man still doesn't even know what medications I take. I have to tell him what I take his medication, and a lot of times he's asking me why I'm taking it. This is ridiculous. Your file's right there. How about reading something once in a while? But his appointment with me is, hey, how's it going? Here's your drugs. Get out. The whole waiting room was like this. If there's 10 people in front of me, I don't even have to wait. I'm waiting 15 minutes to go in because he'll process 10 people that quickly. And, what kind of medicine? This is just, I got paid. That's all I want to do is just getting paid without much effort into doing this thing. I mean, it's, as I say, it's not a noble trade anymore. Years ago, a doctor would get out of his bed in the middle of the night and get on a horse when it's 25 below zero and ride 5 miles to a farm to be with somebody and to, come to their aid as far as health issues go. And we get no money for it, or a couple of chickens or something. I mean, this was a man who was dedicated to the service of others and was concerned about their health. It isn't today. There's, they don't even show up on Friday because they went golfing. They're not available, and the doctors you get, they don't even know you. They've never heard of you. They're not interested in the patient's viewpoint of their health. They just do whatever they want, and this is truly the way it is. I mean, next time you're in a hospital or doctor, just check it out. Your health care really isn't that great. But these people really, really, really get paid well. And I'll tell you one thing, and this is the absolute truth, that if everybody or anybody did their job the way doctors do theirs, you'd be unemployed. You'd be fired right on the spot. Because they call this a science. It's an abstract at best. There's no, let's go in this direction, let's go in that direction. This is my diagnosis, I think. And a lot of times it's just a bad diagnosis, and that's why you don't get better. There were some drugs that were made, say antibiotics that were used, and that can help you with infection. And that the only thing is today, because of the overuse of antibiotics, the infections are resistant to the antibiotics now, and so it was a good thing at a time, but now it's our immune systems are becoming weaker and weaker because of how well we clean our homes, and we're washing our hands all the time, and there's no challenge. The immune systems aren't challenged. You take a child that lives in the house in a clean house will be sick, but you throw a kid outside in the dirt, and for some reason his immune system is tough, and he can endure 100 times what that kid in the house can endure. So you gotta be careful with the advice people are giving you about always making sure you're bacteria free. That's what caused polio to spread. It was personal hygiene was too high, the immune system became weak, and polio spread like it spread all over the country. In fact, I contracted polio in 1957, and I'm okay. Most people were. 95% of people were okay. What happened was the 5% suffered from bones being bent and hard time walking, having used the crutches, and a lot of them ended up in iron lungs, but not forever. They eventually died from it, and it was a tragedy. But anyways, that's the truth about doctors and hospitals. It's an industry, is what it is, and it's a self-promoting industry, because of the more reckless you are at medicine, the sicker the patient, the sicker the people get, and then therefore you've got lots of work coming down the pipe because they have to keep coming back because they're still sick. You know, if doctors were any good, none of us would be sick, would we? Anyways, that's what I wanted to tell you, and you know, have a good day, and try and stay away from hospitals and doctors. That's the advice I give. And you know, if you can get through life without taking a pill, you're doing real good. Good for you. Anyways, see ya.